Earlier this month, House Bill 317 was introduced providing health care for minors, regardless of their citizenship. Delaware will be one of 8 states regarding this health care measure. Joining me today, Ms. Maria Matos, CEO of the Latin American Community Center.
Thank you for having me.
No problem. Representative Krista Griffith. And State Senator and return guest to the agenda, Sarah McBride.
Great to be back.
Welcome to the agenda, everyone.
Thank you.
We have a heavy lift, a big issue that's out there, and that's healthcare for citizens undocumented residents that we have here in our state. And especially the young people. It's focused on the young people here. And Representative Griffith, tell us a little bit about this bill.
Well, thank you, Kerwin. I'm really happy to be here today to talk about House Bill 317 with Senator McBride and Ms. Matos, who has really been at the front lines in leadership and policy around immigrants in this state and country. So House Bill 317 is a bill that would provide medical coverage to children who are undocumented. What it does is it would allow for a family who meets certain income criteria, meaning they would have to be impoverished to meet Medicaid standards or have only limited income to be able to be eligible to receive state assistance so that they can so that their child can go see a doctor for routine care or emergency treatment. Currently in the state, there is no coverage for these children other than life or death emergency care. So what this bill is intended to do is to really provide that routine and preventative care that will give them optimistic long-term health outcomes that other children in the state are able to get because of the programs that are available to them.
So when I hear this, I'm automatically thinking, how did they go? How do these children, and from what I read, it's close to almost 5,000 children that we have right here in the state of Delaware that are underserved, that do not have health care. How has that been just going on? What do they do to take care of themselves? What has been the normal practice that they've done to treat themselves from a health perspective?
Well, I think that Ms. Matos really will be able to describe what she and her colleagues are seeing on a daily basis, and really heartbreaking stories.
Yeah, so what happens, the parents take them to the emergency room because emergency is provided in case of life and death, and the parents are told to get this medicine for the child. But then they go to the pharmacy, can't afford it. So they don't buy it.
They're just skipping right over primary care.
Skipping right over primary care.
And going straight to the emergency room to deal with simple issues and to deal with large issues as well.
Exactly.
Large health issues. So this bill is going to be a stopgap for that, really.
Yes, I think that this legislation is not just morally right, it's financially responsible. Because right now, to Ms. Matos's and Representative Griffith's point, these young people are getting care. They're getting care in emergency rooms, they're getting really intensive inpatient care sometimes through the hospital's charity care. But that cost is then passed on to everyone else. And that means that we are delivering this healthcare in an inefficient way for both patient outcomes and cost for our healthcare system. And so this legislation actually in the long run will help to deliver healthcare to these young people who are already getting healthcare in certain ways in a more efficient and effective manner that'll improve outcomes for these young people, but also reduce costs for our healthcare system overall that then get passed on to every other premium payer in the state. And so it really is a responsible measure to not just do right by these kids who deserve to get care, because ultimately every child's life is worth saving, but it's also a prudent step for our healthcare system, for our state government, for our state as a whole.
So the human infrastructure of everything that's going here in the state, taking care of children, it is a priority, but some people may say at what cost. We talked off the air, is like, what is the cost of life? And of course you cannot put a cost on that, a dollar amount on that, but there are figures that the state has brought up and I guess speculative in regards to what is this going to cost taxpayers?
And that's a great question, and it's an issue that we're going to be dealing with in the coming months as this legislation moves to the General Assembly. The fiscal impact is being worked out currently by our Comptroller General's office to find out what the actual cost will be. But we do have estimates. We have estimates from Nemours who predict that it will cost between $3 and $5 million annually based on approximately 2,500 children receiving care. The Department of Health and Social Services has looked at this and believes that the first year impact would be about 2.9 million and would jump in the second year to 7 million. So right now we have estimates that are anywhere from 3 to 7 million to 3 to 5 million. We will get a final estimate about what that fiscal impact is in coming weeks, and we'll be diving deeper into what that means and how the state will pay for it. But yes, it is, I mean, there will be a cost to this. And we will look at how we are going to pay for that. That will be a significant part of the discussion. But as Senator McBride and Ms. Matos said, the cost of sending these children to emergency care or not receiving care at all. I mean, I look at this from a couple perspectives. I'm a mom of 2 boys who, when both as infants would get routine ear infections. It seemed like every other week we were at the pediatrician's office with an ear infection. And as any parent who's had an infant or newborn or toddler knows, you go, you get tested for that. The doctor looks at the ears, checks, makes sure that there's an antibiotic prescribed, and then that child will come back to make sure that ear infection is cleared up. And if they need, then they can go to the hospital for a procedure that's simple to get ear tubes. When you have a child that's not going to see a pediatrician on a routine basis, they could develop a very serious ear infection, which left untreated could lead to significant hearing loss. And so it's making sure that routine path that we all have, that we learn as children, that you go see your doctor when you're not feeling well, you go see your doctor for routine appointments, you get vaccinated, you have your eyes checked, your ears checked, all of that done. We need to instill those same values in other children as well who aren't getting that treatment so that they can learn how to lead productive and healthy lives.
It makes sense to me.
And not only that, but again, if it's an infection that might have an impact on the public health, then that's another issue. Not giving that kind of care, not insuring those children, not providing them the ability to have health insurance, will it impact public health or other children? I mean, they go to school.
Right.
They're not isolated. They're not away. They go to school. They play sports. They do whatever other children do. And they're around other children. So are we going to take a chance that there may be a spread of something that would have been easily taken care of if they had the health care or the care necessary?
Do you think that you might get some reluctance, not just from people across the aisle or residents here in the state of Delaware, but from the recipients of this care themselves? Would they be forthcoming to say, hey, I need this help, in fear of being deported or making themselves known, or is there going to be an amnesty component built into that?
Well, you'll have a piece of both. You'll have some families that say absolutely not. I know that I need this food stamps or what have you, and they refuse to get public help because that may impact them getting a green card or being here as a resident or a citizen. So there are some families that say, no, I'm not touching it. Then there are some families that understand that their children need health care and will go ahead and take it. But you'll have differences in each family.
Right.
Not everybody's going to go for it. I mean, some people are scared. They're here because they have to work. Not because they wanted to leave their country, but because they have to work, and there is no work where they came from.
Right.
So.
So how are we going to get these, I don't want to call them students, but children enrolled? How do we go about finding who needs that care and getting the care to them?
Well, that's a terrific question, and we're really going to be relying on our community partners. There's a coalition that has been formed in response to this legislation that, everyone from Ms. Matos' organizations to Community Legal Aid Society to the Department of Health and Social Services, different organizations will be
I would
taking
think
part.
education would be in there as well.
Yes, and I'm very proud that the Delaware State Education Association has joined in support of this legislation. So, really relying on our healthcare partners, Nemours, Christiana Care, those health organizations are already used to dealing and treating these individuals. We're really going to be relying on them on helping spread awareness about how to enroll. But truthfully, and the sad thing is, we won't get everybody. There will be people who will not come forward. We know that right now, in order to get that life and death care coverage that the state offers, that's in part state funding and in part federal funding, that there's only about 1,000 children who are signed up for that. Mm-hmm. So though there may be 5,000 children in the state of Delaware who are undocumented, only about 1,000 of those children are currently receiving that life and death type emergency care. So I don't believe that we're going to be seeing huge numbers of children enrolled, especially at first. Yes.
I don't think we'll be saturated. They're just too scared.
Just
Take
too
public
scared.
health.
So is there anything that you would recommend, either of you here on this panel, about how we could eliminate that to make this known for people that really need it and to take some of that fear out of it?
Well, I think what we've seen throughout COVID is that when it comes to getting people to seek the healthcare that they need, trusted community members are key. Maria has been a real leader in making sure that we're increasing vaccination opportunities and education among the folks that she serves. And so that's going to be critical in this effort as well, making sure that folks who families trust, whether that's a healthcare provider, whether that's a community center leader, someone that they're working with, whether that's an educator or an administrator, it's making sure that those folks are helping to educate them so that they can break down that fear and ensure that folks know what is available to them and that they can get the care that they need.
I think it's great. So the other thing we talked about off the air was helping me understand something, and I'm sure people at home have something are going to ask the same question. And I wanted to call it the Doughnut Hole, and you explained to me very well that there is no donut, right? So when we're talking about Medicaid issues and for people that are mature citizens that are moving forward and getting health care, they fall within something called a donut hole where they're not able to be covered. Well, for us, well, not for us, but for these people, they don't have any coverage whatsoever, right? Correct. So there is no donut hole, there is no coverage. They cannot participate in CHIP or any type of Medicaid program because of their status and documentation issues.
That's correct.
So this is it's not a parachute, it's the only thing that they have.
That's correct.
You know, if we can compare, like, we have Head Start through the federal government. The federal government sends Delaware some money for Head Start. But there are some kids that just there's not enough money to give all kids, all poor kids, a Head Start, or all children that need a Head Start. So what did Delaware do? They did ECAP, Early Childhood Assistance Program, which allows an additional 3 and 4 year olds to get the same kind of services and the same kind of education that Head Start gives them. And it's something similar to this. The federal government sends us money for CHIP, and we use it for healthcare for children, the Children's Health Plan.
Insurance program, yeah.
Or whatever. And so Delaware will now take a piece of money and put it into that healthcare, just like they do with ECAP. It's so similar, right?
It's similar. And, you know, we're talking about children.
Children.
We're talking about children who came to this country through not on their own decision. They're here. They need to be healthy. We need to make sure that they see doctors. They're living among our community. They're going to schools. They're going to, they're in the grocery stores everywhere. And we really need to take care of them. They're our most vulnerable citizens. And I think about it in a personal way too. Many people know that I have a son who is now healthy, 7-year-old, very active 7-year-old, tires me out a lot because he's so busy. But 6 years ago, my son was getting out of grueling cancer treatment. He had acute myeloid leukemia, was diagnosed just after his first birthday. And so we went through 6 months of really intense chemotherapy sessions living at Nemours for that treatment. And I know that he's here and with us today because he was fortunate to have early detection and diagnosis of his cancer. But for the fact that he was seeing doctors routinely who could pick up on symptoms that I, as a mom, wouldn't necessarily know were indicative of cancer, I wouldn't have known. And we could have gone weeks and months, and that cancer could have developed into a really vicious, even more vicious form of what he had and killed him. So I know that he's here with us today because he was fortunate to see doctors very early on in the process who could diagnose and treat that cancer. And so it is really a matter of life and death being able to see a pediatrician from the get-go, who is trained and familiar with different, illnesses and diseases to detect that and treat it. Or just as we said, maybe it's just routine care. Maybe it's just, giving affirmation to mom or dad that the child is healthy. We're talking about kids. We're talking about their lives. And I do know, that many people have asked questions about why don't
That's
we?
what I was going to ask. With that being said, what is some of the opposition that you've received in regards to this bill?
Well, I think the primary opposition that we hear are individuals' feelings about immigration in general.
So then it becomes a partisan issue to the point, almost.
I'd hope not.
Right.
Again, we are talking about children. We are talking about saving children's lives, babies.
And Delaware's different.
I think.
Delaware's kind. Delaware, the Delaware I'm sorry, I interrupted you.
No,
but I
Maria,
have to say
please.
that. Delaware's kind. I mean, if you compare us to other states, Delaware is a giving state, And I'm a transplant. I'm a Jersey girl. Well, from Puerto Rico, Jersey. But we are good people, no matter what party you're in. We have good, conscious, disciplined and loving people, I think, for the most part.
And if I may add on both of those points, because I think, we can talk about the costs, we can talk about, improved outcomes, we can talk about the financial responsibility of providing early care and preventative care, but fundamentally, these 2 points really go to the heart of this bill. And one, to Representative Griffith's point, regardless of what you think about immigration issues writ large, I think we should all be able to agree that we should not be penalizing children for any decision that their parent makes. Whether that's a decision around fleeing their country to find opportunity somewhere else, or whether that's a decision that their parent makes in another context, that ultimately every child's life matters, and we should not be forbidding a young person who maybe came across the border when they were 1 or 2 years old in their parents' arms from being able to get that necessary care to keep them and to keep all of us healthy. And then to Maria's point, I think it's such a poignant and powerful one, because one of the things we talk about when we talk about our love for Delaware as Delawareans is that we are a state of neighbors. And when you see a young person who's in need, you don't ask them what their immigration status is. You don't ask them how their parents got here, you help them. And that's true interpersonally, but that also should be true in our public policy. Because if we are truly the state of neighbors that we say we are, then our public policy has to represent that and reflect that. And I think this bill, for all of the just reasons for it, it goes directly to our soul as a state. And whether we can look ourselves in the mirror and say, yes, even when it's difficult, even when it requires something of us, we are truly a state of neighbors, regardless of our difference.
And we do the right thing.
And we do the right thing.
Let DART do the driving. DART First State provides transportation that is clean, safe, reliable, and affordable. Plan your trip and get real-time bus information with the free DART Transit app. Scan your phone to pay your fare with the free DART Pass app. So what are you waiting for? Try transit today. Visit dartfirststate.com or call 1-800-652-DART.
What would you say to some of your colleagues who have mentioned in some articles saying that this will cause Delaware to be a haven for people with that are coming to this country illegally, looking for a place to land, so to speak, and they will choose Delaware among one of those other 8 states because of our healthcare policies? On top of that, as we're trying to bring back the economy, it could, not saying it has, but be an issue.
That's a great question. And the good news is we have data that gives us the answer to your question. Will Delaware become a haven for illegal immigrants as a result of this bill? And the answer is no. What we know is, and that the 8 other jurisdictions that have already adopted a similar policy and assistance to this population have not seen their numbers increase as a result of the legislation. So there is data and research on that point. So to say that Delaware is going to become a haven for people who are undocumented, including their children, they're just not based on fact. That's speculative. And we have data, in fact, to rebut that speculation. So I don't believe that will be the case. I don't, people come here for different reasons, some for employment opportunities, working in different areas in Delaware. What you often see in families who are immigrants is you see a variety of immigration statuses. You may have legal citizens who are living with other individuals who may have green cards, who also are living in the same household with someone who's not documented. So you might have a variety of different immigration statuses in a family unit. And so people come here because they already know people here, or there's some employment opportunity. They're not really shopping around for where their child can get medical coverage. And again, as we said earlier, the problem here is not going to be that we're going to be saturated, as Maria said. The problem is going to be having these families trust in the system that their children can receive the medical care without any penalty.
Penalty, yeah. And plus, have you ever read a bill? I mean, those things are humongous. I barely understand the English. You have to really understand, comprehend what it is that it's offering. And the families that we want to serve, they're poor, and for the most part are either never been to school or have little schooling, because immigrants, undocumented or otherwise, that have doctor's degree and lawyer's degrees, and they're at a different level playing field, So no, I just think it's a ploy that people use to scare. It's a tactic, and I don't see it.
Well, I think that this is doing a lot to rebut that. I think that it's going to be great to ensure that our children are healthy, because they are our children. They're going to our schools. And one thing that we found out, especially due to the pandemic over the past 2 years now, almost 3 years, is that the need for public health and how one person can affect many. And if things are going untreated, it could be such a greater issue. So having a safe gap here where we can deal with things right away, we can have that primary care right away, and things do not escalate, and being able to communicate with families and having a place to go. Also, we do have a nursing shortage right now. We have a huge nursing shortage. We have a doctor shortage.
We have an everything shortage.
We have an everything shortage. There's critical care is critical itself, right? So taking that stress off of the emergency room and allowing for families to be able to go to primary care is also assisting hospitals. So I know that they have to be behind it. And for the hospitals that you've worked with, you've named Nemours and Christiana Care, I think that this legislation is helping them and their issues and everything that they're dealing with.
Primary care is, it's expensive, but it's much less expensive than an emergency room.
For me, one of the first stories that I heard that really motivated me to want to work with Representative Griffith on this was just a tragic story of a undocumented kid here in Delaware who has a terminal illness. And that young person could have been at home, but because they are not eligible for coverage and couldn't get home care, the only way to get the kind of care that they needed was to be inpatient at the hospital. And as someone who served as a caregiver to my husband during his battle with terminal cancer, and ultimately watched him in the last few weeks of his life really struggle coming to terms with this fatal illness, being able to be home, being able to be surrounded by your loved ones, it is the simplest but one of the most important things that we can provide to someone. And so the cruelty of a system that looks at a child who's facing death and says, you can't even go home. I just don't see how anyone could say that that child should be forced in that circumstance to have to undermine their own quality of life with just a few months left in their life. And that this kind of bill would help to provide that flexibility and that care so that a young person who's facing a terminal illness can be home surrounded by their loved ones and their stuffed animals
Right.
as they're facing death.
Allow them to be human.
Allow them to be human.
Wow. Representative Griffith, walk us through the remaining steps of this bill. What's next?
Happy to. Looking forward to this bill going before the Health Committee and the House of Representatives when we return to session in March. So I would see that hearing being probably the second or third week of March. And then from there, it will probably go to the Appropriations Committee of the House, where that fiscal impact that we were discussing earlier will be looked at and will hopefully be approved by that Appropriation Committee and included in the budget, which the General Assembly will ultimately approve before July 1. Once it leaves the Appropriation Committee, it will go to the House floor for a vote and then on to Senator McBride for the Senate.
Yes, and I'm the chair of the Senate Health and Social Services Committee, so I'm eager, hopefully, for it to get through the House and get over to the Senate so that we can hear it in our committee and move it through that same process and hopefully get it to the governor's desk. Yes.
Well, we have a couple minutes left. Tell us what's going on at the LACC.
Oh, everything. What isn't going on right now? The 3 years of COVID, almost 3 years, March 2020, left childcare kind of empty. The slots are not there, the workers are not there, but we're creating a new building right across the street from the old center on 4th and Van Buren. It's going to increase slots by 78. So, and it's infants and toddlers, which people do not want to serve infants and toddlers, and it's needed.
Yeah.
So we're in a capital campaign mode. And what's the other thing? I'm looking to expand our services at like an annex type of accelerated services to Newcastle up there on Christiana Road. So I'm looking at a place up there that I want to buy so that we can do additional slots, additional before and after school, provide services to the Colonial School District because their Latino population has increased dramatically, and our services are needed up there in Newcastle. And then we do the other things. We give out food and do childcare there and teach kids how to be ready for kindergarten.
It's the LACC.
It's the LACC from A to Z except healthcare.
We're working on it.
But no. We have good providers, Henrietta Johnson and Westside Health. They do a very good job. We don't need to get into healthcare, but we do a lot of outreach. We made sure, that people understood that it was safe to come to the LACC and get a vaccine, or provide education on vaccine, or even test on vaccines. We're giving out the test to families. There's just so much to do with young people. We have a youth achievement center, and because if we don't provide the road for these kids, somebody else will,
Right.
very quickly,
Right.
as quick as you can blink an eye. So yeah, we do a lot of things, and hopefully we will continue to work with the state of Delaware. Our senators and representatives were very kind last year during the bond bill, which allow us to move on with the building. And I'm going back again, ask.
Well, ladies, thank you very much for joining us this week on the agenda. This is a roundtable. It's a new format for us, and I'm not going to say good luck with the bill. I know it's going to be just fine.
Thank you.
And we look forward to seeing you next week on the agenda.